Department. My name is Robin Morrison. I'm with the Department of Mental Health Services. And along with me is my colleague and friend. I'll let him introduce himself.
Good evening. My name is Frank Zaneri. I'm the district coordinator of the Crisis Management Program under the Division of Student Services.
Okay. So we are both here to talk to you about mental health awareness and to give you some updated information from both of our departments. Okay, so let me see, hopefully, oh, this does work. I'm doing this well. So I'm going to start off with just some updated information from the Department of Mental Health Services, and then I will definitely turn it over to Mr. Frank Zaneri to provide updates from his Department of Student Services Crisis Management. And then at the end, if you have any questions for us, feel free to ask. Thank you. So in the Department of Mental Health Services, we talk about school-based mental health services within Miami-Dade County Public Schools. And we talk about how we provide mental health services and interventions to students that are in need. And we provide a systems of support to these students and families. And our department works very closely to schools and community agencies to coordinate these services for students and families. We work very closely with other departments, as of course, the Division of Student Services, and of course, with the Department of Exceptional Student Education. We also do collaborations with the Children's Trust, and as you see here, the agencies under the Children's Trust contract that we collaborate with is, of course, Barranquin Medical Centers, Community Health of South Florida, shortly known as CHI, Citrus Health Network, Jesse Trice, Nicholas Children's Hospital, and of course, the University of Miami. So they all have contracts with the Children's Trust, and we do collaborate and work with them. They have mental health professionals along with our mental health coordinators that I will be talking about in a minute. When you hear the term school-based mental health providers and mental health teams, the school-based mental health providers is a term that our state basically came out with and just talked about school-based mental health providers in each district. So in our district, we do talk about our mental health coordinators. We talk about school counselors that are school-based mental health providers, school social workers, school psychologists, and of course, trust specialists. When we talk about how our school-based mental health providers work together, they can work together as a part of what's called the mental health teams. And mental health teams are happening at all schools, and all schools are getting together and discussing and coordinating mental health services for students. For a mental health team at a school site, you have to have a school site administrator. It could be the principal, could be the assistant principal that is a part of this team. Parents definitely are a part of this team, whether they are physically there in the meeting at the school or if they just have to call in or do a Zoom, but they should be a part of the team. When discussing services about their student, you need an educator, so a teacher, that student's teacher should be a part of the team also. And then any mental health or school-based mental health provider or community-based mental health provider that may be working with the student. So it could be any of the ones that are mentioned here on the side, plus any agency also that could be working with the student or the family.
I haven't, Eileen, registered, excuse me, Madam President.
So when we talk about contracted mental health agencies, as we already said earlier, how we work and collaboratively work with the Children's Trust and their different agencies. Within our Department of Mental Health Services, we do have 12 contracts. And with the 12 contracts, these are the agencies that we work with. With these 12 contracts, a school can refer to a family in need for mental health services to any of these agencies as the family chooses. And it would be services that I'll go over in a minute that will be free of charge to the parent in that referral to these agencies. In addition, even though there are 12 contracts, there are really about 17 different agencies, because when you look at number 3, Citrus Health Network, they have subcontracted with 5 additional agencies. And then if you look at number 11, Prosperity, they have subcontracted with 1 agency. The schools have the names of all these different agencies. They have the contact information. So if there is a point in time where a child at a school site would need more than what a school-based mental health provider is giving, it could be more than what a counselor is doing, with one of our mental health coordinators are doing, or social workers doing. If they need more services than what is offered by the school, that school can refer a parent to one of these agencies to provide services for their student. Additional services that the agencies have, the agencies can do mental health screenings and assessments. They can also do individual counseling services to that student, or maybe pull in the student with maybe a sibling to do some group counseling, or even maybe pull in the whole family, or just maybe the parents and the student to do family counseling. If substance abuse is needed, or if this is something that is needed as a service provided by an agency, almost all of our agencies do provide some substance abuse intervention. Our agencies are able to work very closely with the parents to get consultation and information from the parents, and also be able to go into the school and to work closely with the teachers for consultation. If the parent has an outside doctor, or maybe has worked with another agency in the past, some case management can be done also. So these are the services that our agencies, those agencies that we just showed on the last slide, they're able to provide. In addition to services, let's talk about some of our new initiatives that we have within our department for this year. And then we'll go over some initiatives that we're kind of expanding on also for this year. So for this year, for new initiatives, one that I really love with the new Mindfulness Champions Initiative, in partnership with Miami-Dade, Florida Blue, and Mindful Kids Miami, for all students K-12. Here we have a champion, a mindfulness champion that has been trained during the summer, and each school has a champion that deals with mindfulness interventions or activities that they're doing at their school site. So that's one of our new ones, and this is for K-12, all elementary, middle, senior, and K-8 schools. Our next new initiative for this year is Cell Strong. Cell Strong talks about different seminars and activities and roundtable discussions for middle and senior high schools. These usually will have these discussions, and they will be conducted with students, sometimes after school, sometimes during school, but will be basically like small student engagement groups. Maybe bringing in some outside agencies, bringing in different people within the school, some of those school-based mental health providers that will be able to do some discussions in reference to mental health and bring in some information to students. This is only for middle and senior high schools. The last new one for this year has not started yet, and this is the SEL, or Cell School Awards Initiative. Information did go out to the schools, and this is basically a combination of different activities that schools will be able to do, but then they can apply for a school award for the end of the year, to be able to find out all the different activities and interventions that they've done in their schools. And there will be 3 different levels, either a players award, valuable players, you see we like sports here, or most valuable players award also. So more to come from Cell School Awards Initiative. So if we're reigniting initiatives for the 2021-2022 school year, these are some of the ones that we had from last year or previous years that we are also having this year, but we may be expanding a little bit more. So for example, the mental wellness clubs. At first, when we had mental wellness clubs, we had them only for middle and senior high. Excuse me, let me go back. I think I was trying to get somebody in. So in the past few years, we had mental wellness clubs only for middle and senior high. Now this year, we have expanded mental wellness clubs to all K to 12. So elementary, middle, and senior, and K-8. So that means on the campuses, our schools will have mental wellness clubs, and these are clubs run by students with a sponsor, possibly a teacher or a counselor sponsor. And these are clubs that will basically, students will be able to look for information or work with adults on their campus or in the communities to basically talk about mental health initiatives and mental health information that they want to bring to other students within their schools. So this is really good. I think we just had a club sponsor meeting, and we even had a task force where we actually talked to some of the students from the mental wellness clubs to get information so we'll know how to better be able to help them as a department. Another initiative is Teen Mental Health First Aid in partnership with the National Council on Mental Wellbeing. And this is for one that we've had in the previous years. Our first year, we piloted with Homestead Senior. And then last year, I think we had maybe about 18 schools. So now we have some additional high schools. This is only for high school, teen mental health. And this is like our youth mental health training that we have for adults, but this is to talk to students. And normally this would be either in 10th, 11th, or 12th grade. We do not do teen mental health presentations to any 9th graders, only 10th, 11th, and 12th graders, where we're actually looking at teen mental health and talking about the stigma of mental health and providing information and doing some discussion time with students in reference to mental health initiatives and those look-fors in reference to mental health if there are needs. And this, again, is only for senior high schools. So we expanded the number of high schools that we are going to be working with this year. Great minds, great athletes. This is, we've expanded this year to additional middle and senior high. And I believe we had a kickoff today in reference to this. With great minds and great athletes, we're talking about mental health and athletes now. And this was a big one for us also. And looking at and working closely with coaches and working closely with parents, and of course, working closely with those students who are student athletes in middle and senior high schools. Ending the Silence program is a partnership with the National Alliance on Mental Illness, NAMI for short. And we've had this since day one, since our department opened in 2018. So I say probably the earlier part of 2019, we started working with NAMI. We added additional middle schools and additional high schools. And we have someone from the National Alliance with Mental Health, NAMI, coming out to speak and do presentations for our students also in those selected schools. Mindful Peer Exchange is another partnership that we have here with Florida International University, where we have sophomore level psychology majors that come out from FIU, and they do presentations in reference to selected senior high schools. This is only for senior high school students. So as you see, we have a lot of different initiatives that we're doing within our department, either that it started in the previous years and we're expanding on, or those new initiatives that we started this year and we'll be working on also. And we're trying to cover all grades from K to 12. I know focusing a lot on secondary. Here, and I know you know, all districts in the state of Florida have to have 5 hours for grades 6 to 12, that mental and emotional health requirement. So this is starting soon. where this is for grades 6 to 12. So we'll be starting again, and this is every year. It started last year, so every year. So for the implementation for this year, again, it will be online for our students. It will be to grades 6 to 12 only. Implementation plan for this particular school year. Again, it will run through our language arts classes. So our teachers and our mental health, school-based mental health providers will be working on this together. So the actual 5-hour course will be done within a language arts class, but the discussion pieces will actually happen with our school-based mental health providers. So counselors can sit in, our mental health coordinators or psychologists can sit in and just kind of discuss what students have learned online, answer any questions. Each school will have a plan on how they're working on this to maximize the success of this requirement. My next couple of slides will be quick before I turn it over to Mr. Zanier. But I wanted to get into, and I always try to talk a little bit in reference to some of those childhood experiences that kids experience and then they grow up, and we call them adverse childhood experience. You hear the term trauma, you hear the term depression, you hear all kinds of different terms that are kind of thrown out there, but we don't usually hear the term adverse childhood experiences or ACEs. And this was a study that was done a while back, over a decade ago, where you've had a group of people and they looked at the people's childhood to basically find out, what went on in their childhood experiences that basically affect them as adults now. It could be affecting them mentally, socially, emotionally, and even physically also. So that's why they're called adverse childhood experiences. Parents, one thing to know in reference to these childhood experiences, through this study, the top 8 ACEs came out through this particular study. And they talked about some of these things that are listed here. These are the top 8. And this information here has been shared with students, has been shared with teachers, has been shared with administrators since day one of our opening of our department. So we wanted staff working in the schools to know that these are some of the things that kids are going through right now. In this study, it talked about how they're going through this and how participants in the study went through this and how it affected them later in life. But the whole purpose of this piece here is to talk about the different things and what's going on with our students and how can we work with our students that may have experienced some substance abuse in the home, maybe some parental separation or divorce, and how is that affecting the child in the classroom, mental illness in the home, maybe with a parent or a grandparent or a sibling. Maybe our student may have witnessed some domestic violence or hopefully not, but suicidal household member. So you see the seriousness of some of the things that we're talking about here. Death of, especially during this time of COVID, many family members have passed away. Or loved ones in the family or friends or neighbors. How does this affect the child? Parental incarceration and experience of abuse or neglect. Again, based on a study, these were the top 8 that came out. A couple of more that came out during this study. And these are things, if you think about it right now, as I said, whether it's COVID, not COVID, or whatever, these are things that are still going on in children's lives. So you can look at the exposure to a natural disaster. So you think about where we live. I'm originally from Philadelphia. I knew what I went through when I first came here and first saw my hurricane, and what I went through and how I felt. And I was an adult at that time. So imagine what kids go through, or if they're coming from other countries coming from either a country that has had hurricanes or that has had earthquakes or any other type of natural disaster. There could be some type of criminal element in the home, and kids see this, and or they have family members that are involved, or friends or family members that bring friends to the house in reference to the home where that criminal behavior is going on. Terminal or chronic illness, not just the death of a family member here, a long-term chronic illness. So this child sees this on a period of a day or two, or coming home and someone in the family is extremely ill, not knowing what's going to happen to that loved one in that family. Homelessness, victimization, or bullying also, we hear this. So these are some of the different adverse childhood experiences that came out of that study. And as I said, the others on the other slide, the first initial aid plus these are things that some of our kids are going through. In looking at this information and thinking about what our kids actually do go through and how stress plays a big part in this. A lot of parents have asked in the past, how can I help my child? How can I talk to my child? And of course, you have the school. We are here to assist. You have those school-based mental health providers. You have contracted agencies that I just went over where the schools can make a referral. But if you're at home, and sometimes if you feel that your child is going through different things, it could be homework, it could be just day-to-day stresses, who knows? And little ones go through this. That's why I put a picture of a little one here, because a lot of people think it's only maybe your middle school or your high school, but you have little ones that go through this also. There may be different things that you can do as parents, and we said the same thing in reference to our teachers and staff in the school. Teach them really quick some different calming strategies, breathing. And I've observed some of our mental health coordinators when I go out, and how they use breathing techniques or counting to 10 just to keep them calm and to bring them down a little bit. Start off a dialogue about stress, but just kind of keep it light. Even with your little ones, you'll be surprised. Find good distractions, maybe just playing a game. Take them outside, get them outside. Let's get some fresh air. Doing some things around the neighborhood, something fun to make them laugh, getting rid of that stress. And you probably think, what do little kids have to be stressed about? It could be the littlest things you don't know. But if you see a change in the behavior, then these are things that you may want to do just to keep them at ease with themselves and what's going on. A lot of parents in our presentation, sometimes people are still asking, my kids are still talking about COVID-19. Are there any tips? Are there any things that we could do in reference to talking to our children in reference to this? We still have some kids that are a little nervous about this and whatever. I think that anytime that you are talking to your children about something that they're nervous about, you need to remain calm. You need to reassure the children are safe and make sure that you're listening, paying attention, and providing information that is truthful, appropriate, and so on. And get them off of social media, definitely. Our last couple of slides will give you additional information in reference to where to go for assistance. If you feel that your child or you and your family need some assistance and you see the numbers that are there, I know you're going to get a copy of this PowerPoint. And additional resources for parents, whether it's different websites with different information, whether for elementary, middle, or senior high, or teen mental health information, or even an app, Headspace, that we use within the school district also. And then, of course, CDC is out there in reference to mental health and COVID, and how to talk to kids and teens about COVID and anything in reference to COVID-19 as a parent resource. Our website is here also, so feel free, please go on our website. We update our website basically 2 or 3 times a month with resources and up-to-date information on mental health and social emotional and behavioral health for students and parents and for staff also. We do have a parent assistance line, 305-995-7100. And from Monday through Friday, someone will be there answering the phone between 8 and 4 o'clock p.m. if you have any questions or concerns. And this is how you can reach anyone in our office. These are the administrators, Ms. Sally Allion, our assistant superintendent, myself, Robin Morrison, or Ms. Liani Cuba, in reference to mental health services and any information. So I would like to turn it over to, again, my friend and colleague, Mr. Frank Zanier, in reference to mental health initiatives and resources. Mr. Zanier.
Thank you, Robin, and good evening. Robin, if you wouldn't mind forwarding the slides for me since you have control of the PowerPoint.
I sure will.
Okay, thank you. Yes, I am the district coordinator of the Student Services Crisis Management Program. And I'm here to share with you in a brief format some thoughts over our programming and the resources offered for our students. The bedrock of our program really involves our school counselors. We have school counselors throughout the district in every school, although I will say this school year we are short some counselors for a variety of reasons. They are the ones that are the 5-day-a-week mental health professionals on campuses that are the go-to individuals for our children who are struggling perhaps with academics, with social emotional wellness, perhaps some mental health challenges. And we certainly want to emphasize how these are skilled mental health professionals that are there, again, for our children. The TRUST program, the acronym TRUST means to reach ultimate success together. And these are specialists that are in many of our secondary schools that work with students who are having mental health challenges. They work in the area of substance abuse prevention and intervention, as well as students that may have other self-defeating behaviors. The crisis management program, which I oversee, is a unit of the Student Services Department that responds to tragedies that occur within the community that affect our students and our faculty and support staff. Whenever we have the death of a child, it's always a tragic situation, but our team goes out to the schools, works with students, works with the faculty, works with the administration to help as best possible support them during their grief. The SAFE network, which is representing School Allies for Equity, is an LGBTQ support network that has one staff member who has been trained in every school campus to work with students who are LGBTQ as well as their families and offering support resources. Next slide. Social emotional learning has gotten a lot of publicity in recent years, and it should, because they really are the bedrock of mental health. There are 5 pillars associated with SEL: self-awareness and teaching students how to manage and understand their emotions better. That self-management piece is very important because we know that young folks have a lot of strong emotions, and how they manage them or not often dictates their level of wellness. Social awareness and all the social systems that students are in, whether they be in school or within the community or within families. Developing relationship skills. How do you make healthy relationships and maintain them? And of course, all important decision-making skills for critical life situations, as well as other decisions that maybe don't take a lot of thought, but sometimes don't go the way we would want. Next slide. We do have a number of social emotional learning curricula, and these curricula are available within our schools at different grade levels. We're using the Cloud9 World K-8, Lawrence Kids K-12, Monique Burr Foundation, all the way through the district, Quaver SEL, and Sanford Harmony from pre-K to grade 6. Next slide. You see in Cloud9 World, we're teaching 30 different character strengths to our students in middle school. Focuses on developing decision-making skills, which we know are so critical. Lauren's Kids Safer, Smarter Schools program teaches children about personal safety, which also deals with prevention of child abuse and sexual abuse. The Monique Burr Foundation educates and empowers our students with a lot of strategies, knowledge base to prevent, recognize, and respond to bullying, cyberbullying, child abuse, exploitation, which ties into human trafficking, and of course, digital dangers on the internet. All of these programs are very well researched and very well intended to really target the types of behaviors that we know support social emotional wellness. Next slide. Quaver SEL deals with positive life habits and mindsets and really focuses upon everyday problem solving. It's very practical. And lastly, Sanford Harmony here focuses on intergender communication and connections and community in school and outside the classroom, also in developing compassionate and empathetic caring adults. Next slide. Another district-wide initiative that we have in student services is our bullying and harassment prevention. We have a well-developed policy against bullying and harassment, which is currently under revision, but that's been with us since about 2008. We have a full-scale prevention curriculum that has 5 lessons per school year from pre-K to grade 12, which is a mandate that all students must receive these lessons each and every school year. Next slide. The Values Matter Miami initiative has been around 5 or 6 years, and the Division of Student Services has taken a lot of pride in this particular initiative, which really not only teaches students, but reinforces for students our district's core values: respect, responsibility, integrity, fairness, honesty, kindness, pursuit of excellence, cooperation, and citizenship. And all of those are 1 a month types of focus areas. And at each month, we have all sorts of activities that schools get involved in classroom instruction around these particular values. Next topic. The Grief-Sensitive School Initiative has been around for about 4 years now, I recall, and it comes to us from the National Center for School Crisis and Bereavement, which is based out of Southern California, and the New York Life Foundation. This partnership with Miami-Dade County Public Schools has brought training through our district, through the Parent Academy, through professional development for our school mental health professionals and faculty. They've also trained many of our school counselors to run grief support groups within the schools. And they are considered community partners, as are the Children's Bereavement Center and Vitas of Miami as well, works with us in helping out children and families that have suffered loss. Next slide. So this is our contact information. Our Administrative Director, Martha Harris, and our Executive Director, Sharon Krantz. We have, again, a good representation within our division that oversees the school counseling programs, the college assistance programs, the trust program, crisis team as well. And we are there to serve our students, staff, and parents as needed. Thank you for the time, and if we have time for any questions, certainly we'll make ourselves available. Thank you.
Thank you, Mr. Zamir and Ms. Morrison. We really appreciate that. Does anyone have any questions? You can unmute yourself, or you can put it in the chat, and I'll monitor the chat for a few minutes.
Yes, hi. Oops, they can't really see me, but I have a question, and I'm not sure if it has a little bit to do on everything you touched today, which was wonderful, but in a few of the education complex municipalities, there has been at least of 1 or 2 that had a presentation. I am not 100% sure what group it was, but the presentation was on an initiative to possibly bring universal mental health screening to all our students. Have you all know anything about that? Is that something that was presented from the school district, or is it outside parties that are trying to bring this towards our school system? Have you heard about any of this?
Yes, I can speak a little bit about this. This is something that the district is looking into as an initiative, as a pilot. That's all I can tell you for right now. But I do know that there are people also in reference to the community that are looking in this, but I know our district is looking at it also.
Thank you.
I have a question. In regards to the programs that are being available, how exactly would I get service for them for my son? He's in 2nd grade.
I would talk first and go to your school. Right now, we have mental health coordinators in all schools. There are counselors in all schools also. So your best bet would be to talk to school site administrations, talk to your teachers, and let them know what your concerns are. And this starts basically at the school level. In reference to administrators, your teachers, our mental health coordinators are there maybe once or twice a week, but our counselors are there also. We have social workers and psychologists. So if you saw the list of names or titles that were there in the schools. So I would definitely tell you, if you're looking for services for your child, please talk to your school site administration. Even if you're looking at services for your family, then we do have the contracted agencies that I talked about also. And then those contracted agencies can see students in the school, they can see students and families at home, they can see students and families in their office, or they have been seeing students and families through teletherapy, through a Zoom session also. So there are many different ways, and there's help, but it initiates at the school level.
Thank
I
you.
hope that answered your question.
I don't see any more questions in the chat. Does anyone have any other question? Okay, someone is, someone in the chat put that their youngest one is in 5th grade. Many parents are concerned and have questions about security and bullying in middle school. I have a 7th grader, so I had been able to share experience positive, but why isn't the fact that there is a threat assessment team shared with parents? That's
Okay.
what someone put in the
Miss-
chat.
Mr. Zanier, did you want to touch on it?
Well, in terms of the bullying issue, again, we take it very seriously because student safety is #1 over everything. And we advertise, we create greater awareness about what we're doing in terms of prevention, rather than waiting for the problem to happen. And I think that's the great value of the curriculum that we have in place. But also all the resources we have. If there's anyone that is not following or leading or going down the wrong road, let's say, getting in difficulty, whether it be something behavioral with a student, some acting out behavior, but if it crosses the line over to bullying or harassment, that our staff is trained to intervene, to not accept that under any circumstances. What we do know as well is that bullying happens in seconds sometimes, and we may not see it initially. So we're trying to find a multitude of ways to make our children as comfortable as possible to report anything that they experience personally or that they witness happening to another friend, and to get that information as quickly as they can to an administrator to investigate. So we have anonymous reporting forms. Students can text, students can call it in, they can email it in. They can certainly go directly to a bullying reporting box that every campus has. So we have a lot of ways of getting the information out. The important thing is that students need to speak up, that we don't tolerate bullying once we know about it. And the key is knowing about it so we can investigate it and then put that type of behavior to an end. That's kind of our approach around it. I see someone has a follow-up to that.
Yes, they do. That they have online resources for kids and teens, and who should they get in touch with to possibly become a contracted agency to help with the students and families.
Okay,
And-
and I saw a question in reference to mental health services in the
Yes.
chat also at all
Yes.
schools. We do have our mental health coordinators that are servicing all schools. So yes, mental health services are there. They do work in collaboration with the other school-based mental health providers that are there. In addition to that, we do, as we've said before, with the Children's Trust, or they have their mental health providers that are in schools also. And this year we do have roughly about 90 part-time mental health providers that are contracted with some of those same agencies that you saw earlier from our department. They are also in the schools providing mental health services. So there are different providers from different agencies, or either they are hired like our coordinators through Miami-Dade County Public Schools. So the services are there. In reference to, I think the question was in reference if you're interested in being a contracted agency, you could reach out to our department. And I think our information was on that last slide that I had showed. Feel free to reach out to us if you have any questions about being a partner or being a vendor that contracts with us also, and we can assist you in that route also.
Thank you. Ms. Rati, you had a question? Your hand is raised.
Here she is. Hi, Ms. Rati.
Hi, it's a follow-up from, I'm the one who asked about the middle school, and I share information about bullying, and your departments are I share all the forms and everything. My question is about the threat assessment team. As a parent of a kid who has been bullied and will be bullied because he has high functioning autism, it's very comforting knowing that the school has a team that is trained. Why aren't we sharing that information more? This is a constructive criticism. Like I'm trying to, that will help. The other day we were discussing at the panel that maybe changing the name, but knowing that there is a specific team that is being trained and that is taking care of this, as a parent, that is comforting. That is good to know. And what I love about the team is that it's not only counselors, it includes teachers and SROs and police officers.
Yeah.
So that's another issue, the importance of the training. Share more about the importance of the training that you are doing. I know you're doing with our police officers.
Yes, we are.
It's incredible how much it has changed. My son is in 7th grade, so I've seen the evolution, the acceptance, and the training works. So keep doing that because it really, really works.
Thank you, Ms. Prati. Also, an administrators on those teams also.
Yes, that is what I'm shouting at. I'm always telling parents, look, the school is taking care of this.
Yes.
You know, I'm trying to calm them down. Bullying happens. It happens everywhere, even in private schools. It's what you do when that happens that matters. And our schools are taking care of that. And I want the schools to promote that. You know, the threat assessment team is important. And thank you for doing that.
No, thank you, Ms. Prati. It's good seeing you again.
Thank you.
I think we got other questions. Final call. We're good. Well, thank you so much, Ms. Morrison and Mr. Zanier. We really appreciate it. You know, taking your time. I know it's a long day for you. It's a long day for for some of us as well. But we really do appreciate it. Thank you so much.
Thank you for having us. Thank you
And
all.
we're going to be posting this recording and the PowerPoint on the Miami-Dade Council PTSA, so it'll be available for everybody to view at their leisure. And thank you for letting us post your PowerPoint. We appreciate it.
Thank you.
Take care.
Take care. Bye-bye.
Good night.
Thank
Good night,
you.
everybody.
Thank
Thank
you.
you.
Good night, everyone.